Hey everyone, this is Manu, Kalia, a physical therapist. I'm joined here by my coworker Eric and also Kathy, who's helping us out today. And she's going to help me show you guys a really cool technique for patellar femoral problems, also for patellar tendonitis or patellar tendinosis, which is some degenerative changes of the patellar tendon. So I'm going to show you a massage technique. It's called cross-friction mobilization of the patellar tendon. Kathy, let's have you bring your leg around. Okay. So what we're going to do is, if you're suffering from problems having to do with the patellar tendon pain, which is most of the time you're going to find pain along the patellar tendon, which sits right about here. So this is the kneecap. So if I push the kneecap up, I pop it up. You see how it raises up at the bottom? That's where the patellar tendon is sitting and attaching right about there. So the problems can be, you can have some thickening or adhesions that can form all along that tendon or along the border of the kneecap too. So whether it's due to overuse or excessive use or improper use or foot mechanics are off or the knee issues are going on. So all these things can result in a lot of these problems. And also a lot of times after post-surgical issues, you'll also find people having these problems. So what we're going to do is we're going to break down that thickening and those adhesions, and this technique works really well. So what I'm going to do is I'm going to lift the kneecap up. So as it raises up from here, I'm going to stabilize my index finger with my middle finger, and I'm going to dig in right about there. Now remember, you're putting a little bit of pressure, you're going across the tendon. Tendon sits this way, I'm going across. So I'm going perpendicular to the tendon. So I'm going underneath the kneecap and I'm going across. Now, this does no good if I'm rubbing on the skin. It doesn't help the problem. You need to get underneath it and you need to work on that tendon. And you might find spots that are more tender than others. So I might be here and I'm going to work on this for a bit, and then you might have to shift out to the side a little bit. So you're going to search along the border, the inferior border of the kneecap. So all along here and along here too. So wherever you find thickening or tender spots, you're going to dig in and you're going to work on that. Now, of course, the patient can be taught to do that by themselves too. So that's the first thing. So you're going to work at lifting up the kneecap from here. So it exposes the tendon more. And then I dig in and I work through there across. So about 5 minutes, 5 to 10 minutes maximum usually works well. People don't tolerate this more than about 5-10 minutes. Okay. So to follow up on that, the next thing that works really well is doing, after you do the cross-friction massage, you do some pump massage of that tendon. So let's have you bring your leg down. So once I've done some cross-friction stuff of that tendon, I'm going to do some tack and stretch or pump massage. So if there's some adhesions or just thickening along that tendon, or I want to promote some circulation to that tendon, here's the tendon again, I can tack it down and I can push up. So I'm stretching that tendon and I'm bringing it up. I tack it down and I stretch. So I put pressure on it, tack it down, and I stretch it and I bring it down. Raise it up, tack it down, stretch it, you're good? Mm-hmm. And I go, and now I can also go across on the side here. So if she's a little bit tight through this region, so I can put a little pressure there and I can do some tack and stretch of the myofascia and surrounding tissues that might be tightened up too. So tack and stretch, tack and stretch. Now, to make it a little more dynamic, I can have Kathy go ahead and pull your knee down towards you so she can kick back. There you go. So she's contracting your hamstrings, these guys, which is the opposing muscle group to your quadriceps. So go ahead and pull down, and I tack it, and I pull it. So I'm letting her do the work, and I'm stretching the opposite muscle group, which is her patellar tendon and her quads even. So go ahead again. There you go. So tack and stretch. So I'm going to work at. So I made it a little bit more dynamic, and I also added some exercise to it. Pull down. Very good. Okay. So very effective for patellar tendonitis, tendinosis, and also if there's some degenerative changes going on along that region, or just thickening post-injury, post-surgical. So it works quite well to relieve all those adhesions and restrictions that are there. Hope you found this helpful. Thank you, Eric. Thank you, Kathy. And please subscribe to the channel and leave a comment. Thanks.